And we do have a live on this. Let's bring in the expert on this, Dr. Agbor, to speak to us now.
Hello, thank you for having me.
All right, let's look at this situation now, because it looks like we're having an increase in number of cases because of and a lot of medical experts like yourself have attributed this to the Delta variant. 6 states have now, including the Federal Capital Territory, have now been placed on red alert. Is that enough if we're trying to curb the spread of a very virulent nature of this virus?
Well, in a situation like this, you must agree with me that if countries that have no economic capacity, health infrastructural capacity, have had to battle with this situation, and then had to also find it difficult to meet up to expectations. We do not expect that whatever activities we put in place will be sufficient, but it's better little than nothing at all. We do know that there was a first wave and that there was a second wave and that there's going to be a third wave, simply because the same situation, the same circumstances that preceded the first and the second wave are still in place. We do not have enough Nigerians vaccinated, even if we know that at least 3.6 million vaccines were brought into the country. We just have less than 1%, or about 1% of the Nigerian population vaccinated. And vaccines only work when you have a significant number, at least 70% of your population working. So vaccine-wise, I don't think we are significantly, or we are not even protected at all, because the vaccines have been shown to reduce the severity of the infection. So that is one. The second thing is that in the past, even before the second wave and all that, we already had certain measures in place. People were more at alert, there was more fear. So you had people using their face masks, maintaining hand hygiene, and maintaining social distancing, and increasing their access to information. But a lot of that has collapsed. Just before this interview, I put call across my network across Nigeria, and I can tell you for free that in many states that are outside some of these key states like FCT, Abuja, and 1 or 2 other states, people have completely discarded the use of face mask, except maybe on TV or on some.
And you're leading, Dr. Ebuta, you're leading me to my very next question, which is where the states come in, because it looks like the federal government continues to take the lead on this issue, and now is asking the states to heighten their level of preparedness. Where do the states come in here, especially when it comes to enforcing all of these non-pharmaceutical measures?
Yes, those non-pharmaceutical measures are the most cost-efficient and cheap interventions we can put in place. We already know that the Delta variant is at least 6 to 7 times more transmissible than the previous variant we've had. Even the Delta Alpha variant was not this transmissible. So it is a super efficient bug, and its capacity for transmission is very significant. That means that our non-therapeutic measures, public health measures like distancing, hand hygiene, avoiding crowds, and if you are in a room all by yourself with some other people, you should ensure that it is properly ventilated. These are the simple measures that we can put in place, because we don't have the capacity to deploy vaccines within the next couple of weeks to stem the third wave. And apart from that, we do know that some people are likely to be infected. So we need to look at our health infrastructure again and see how we can beef it up. We need to guarantee that we have oxygen where patients will need oxygen. We need to ensure that the health workers are updated in terms of their skill, their information, and how to deal with patients with COVID. So we need to deepen training across board. We need to train
absolutely, but Dr. Ebuta, because we see what's happening now in India. We saw what happened in India. It seems to have shifted to Indonesia. We're seeing that spike in number of cases, demand for oxygen because of a lack of it. How quick and how fast should we put this in place so we do not find ourselves in that position?
Well, I do sincerely believe that there is nothing as impossible if you have the will, the political will, and if you back such will with action, financing, and you put the right people in place. We need to deploy oxygen. We need to have oxygen everywhere. People should not die because of lack of oxygen. Apart from that, people should not die because of lack of information. We still have a lot of people who do not believe that there's COVID. So we need to deepen and restructure and recalibrate the kind of health education we're giving out in a manner that people can understand. Where are the traditional rulers? Where are the religious leaders? We need to sit down with these people and educate them. It will shock you to know that some of our influencers, so to speak, may not have the complete details. Some of us who are health workers who are opportune to see patients and treat patients on a daily basis. These are real to us. We see patients. Recently, I had someone who is quite close to me who had a situation like this. And so these are real to us. We see patients, we see relatives who have these conditions. And when people have COVID, we get calls. We have to we have to advise, we have to provide prescriptions, we have to provide logistics, we have to direct them on where to go to get the healthcare system, healthcare intervention they need. So a lot of people who are not in the health sector, who have not come in contact with any patient with COVID, we believe that obviously there is no COVID. So we need to deepen information. Yes, we are lucky in Nigeria because we have a relatively young population. Less than 7% of our population are more than 65 years. And I think less than 18% are more than 50 years. So we have a relatively young population. But we must approach this with caution because as we've seen in the UK, where vaccination penetration is about 40-50%, we've seen a lot of young people come down with illness, clinically significant COVID infection, which may not have resulted in death, but has resulted in significant illness and created tension in the system. Nigeria currently just has 1% of the population vaccinated. So we do not even have a vaccinated population, practically speaking. So
absolutely.
We cannot depend on vaccination for protection. We must remind our people to mask up, to keep a hand hygiene, to maintain social distancing as practical. And then when they are in a closed place with people, they cannot guarantee. They should ensure that there's significant benefit.
All right. So I hope that, Nigerians are listening right now. Like you said, some people are still very skeptical about the COVID-19 pandemic. So we hope that more is done in that regard. Health practitioner, Dr. Agbor Ebuta, thanks for talking to us.
It's a pleasure. Thank you.